Today, let's talk about effect of ticagrelor and clopidogrel dual antiplatelet therapy on mean platelet volume to lymphocyte ratio, maximum amplitude of adenosine diphosphate-induced platelet-fibrin clots, and arachidonic acid inhibition rate in acute coronary syndrome patients after percutaneous coronary intervention. Coming to the objective, to explore the effects of ticagrelor and clopidogrel dual antiplatelet therapy on the mean platelet volume to lymphocyte ratio, that is MPVLR, maximum amplitude of adenosine diphosphate induced platelet fibrin clots, that is MAADP, and arachidonic acid, that is AA inhibition rates in patients with acute coronary syndrome after percutaneous coronary intervention. Coming to the methods, a total of 120 patients with acute coronary syndrome undergoing elective percutaneous coronary intervention in hospitals between March 2020 and November 2021 were recruited. Patients were divided into two groups using the random number table method with 60 patients in each group. The control group received clopidogrel plus aspirin dual antiplatelet therapy, while the study group received ticagrelor plus aspirin dual antiplatelet therapy. MPVLR, MAADP, and arachidonic acid inhibitor rates were compared between the two groups. Platelet activation indices, platelet microPNA 223, and platelet gelosine levels were measured before and 4 weeks after percutaneous coronary intervention. Changes in cardiac function indices, bleeding rates, and major adverse cardiovascular events were compared between groups. Coming to the results, the MAADP score of the study group was lower than that of the control group 3 days after surgery. Compared with before surgery, CD62P, CD63, MIR 223, PAC1, platelet membrane glycoprotein, and gelosine levels markedly decreased in both groups 4 weeks after surgery. The platelet activation index and platelet MIR 223 and gelsolin levels were significantly lower in the study group than in the control group 4 weeks after surgery. The overall platelet inhibition effect was significantly better in the study group than in the control group. Compared with before surgery, the left ventricular ejection fraction and stroke volume were significantly increased, and the left ventricular and diastolic volume and left ventricular and diastolic diameter significantly decreased in both groups 4 weeks after surgery. No significant differences were found between the two groups in terms of the incidence of bleeding events or major acute cardiovascular events. To conclude, ticagrelor is more effective than clopidogrel for platelet inhibition after percutaneous coronary intervention in patients with acute coronary syndrome and is worthy of clinical recommendation.